Obviously, we've seen from all spectrums, we've seen the accelerated use of telemedicine and technology like we've never seen before in this time of age. Can you talk about the role of telemedicine that has played in treating patients with epilepsy? And is this something that we've seen that you're accustomed to prior to the pandemic, and is now something kind of just been a bigger revelation now?
We've used telemedicine before, but nowhere near the degree that we're using it now. Right now I'm doing the lion's share of all of my patient contact via telemedicine. And I think that's going to probably stay significantly more than we've used it in the past. I think it's a lot easier for families, particularly if you have a developmentally delayed child or a medically fragile child, and you're having to travel 6 hours for a medical appointment and 6 hours back. I think a lot of times we can do that by telemedicine, and we just haven't done that. So I think it will be easier for families. I think as far as sort of new consults, I think it's a little bit more challenging because you can't do the degree of physical examination that you often will need to. So I think that although you may be able to, temporize, and that you can see a child by telemedicine and, figure out sort of the risk, do they need to be on a medication or not, but then bring them back after the pandemic is over and things are a bit more stable. I think you can do it that way, but I don't think for new consults, I would be surprised if telemedicine would take over that for the most part, just because we can't get as good of an exam.
And I know you said you haven't come in contact with anybody personally who has COVID-19 with epilepsy, but how has your clinical practice been affected, and what are you doing to try to maintain a level of patient care that is up to your standard in such a difficult time?
Yeah, so I think the biggest challenge is unless things have been, really very urgent or emergent, it's been very challenging to get patients into the clinic and particularly into the hospital. And so for, I think, our center and other centers across the US, it has almost put a stop to patients who are being worked up for epilepsy surgery or patients who are candidates for epilepsy surgery, just as far as having the procedures done, and it's delayed all of that. And while those kids, it may not be sort of emergent, those kids are still at risk. They're having frequent seizures. They are potentially at risk of sudden unexpected death and epilepsy. And so I don't think, I think there's a potential downside as well to delaying this. We have other kids, for example, who are hoping to start the ketogenic diet. And if you're very young to start the ketogenic diet, the safest place to do that is in hospital. And so some of those therapies have also been delayed. Some of the kids where we're trying to sort out, is this a seizure, is this not a seizure? We've not been able to get them into the hospital to capture their events on EEGs. So I think it is delaying a lot of the important day-to-day stuff that we do. We try and mitigate that with increased access to telemedicine, and we're doing the best we can, but it's not complete. It's not as good.